How's it going, guys? It is 4:07 a.m. Sunday, February 5th here in Japan. We have a medium difficulty question for pediatrics. No, actually, difficult question for pediatrics for TCK. Difficult question for step one, studying for pharm. I'll tell you some highlight points we need to know. Before we get started, please subscribe to my channel. I really appreciate it. Give the video a like. I really appreciate it. Find me on Instagram at mehlman_medical, mehlman_medical. Links down below. Find me on Telegram. Links to the Telegram group and channel are down below. Now start the clip. Female, newborn, mild cyanosis, heart sounds auscultate on the right side of the chest. Echo confirms our dextrocardia and mitral regurg. Blood smear shows howell-jolly bodies. Question wants to know the most appropriate prophylaxis for this patient. So very obscure / nebulous vignette. You say, what the fuck's going on here? Okay. Well, some of you watching this clip who are quite astute might be aware that dextrocardia is often seen with Cartaginer syndrome, aka primary ciliary dyskinesia, which is not the diagnosis here, but is nevertheless exceedingly high yield for steps 1 and 2, where you're going to get a vignette real quick tangentially where it sounds like CF, sounds like cystic fibrosis, but you get dextrocardia or situs inversus, and they want you to know that is dynein arm defect. Okay, you need dynein arm within cilia for cilium function. Okay, that's Cartaginer syndrome, primary ciliary dyskinesia, not the diagnosis here, but high yield for USMLE where you see dextrocardia. So in this case, USMLE doesn't give a fuck that you know this is ivemark syndrome. USMLE doesn't care, okay? This is forest for the trees. What we have here is you read the vignette, you have no idea what's going on, and then we see, okay, well, there's howell-jolly bodies. Now, howell-jolly bodies, that's past level. That just means you have asplenia. So patient either congenitally has loss of spleen, could be seen in things like sickle cell where you get microinfarcts of the spleen or post-splenectomy. So these are nuclear remnants. So we have asplenia here, okay? And the question is just asking, well, what kind of prophylaxis would we give to patients who have asplenia? So let's just whip through the answers here. We'll go backwards. Choice C, platelet thromboxane 2 irreversible inhibitor. That refers to aspirin. Wrong fucking answer. Okay, long discussion regarding aspirin. For USMLE, you could know that this is given to patients daily who have ischemic heart disease. Okay, patients who get angina pectoris, as an example. Patients who have carotid stenosis and need antiplatelet therapy. Patients who have ischemic stroke, who present after 4.5 hours. So rather than TPA, you give aspirin. Aspirin can be used for atrial fibrillation if there's a low CHADS score. So lots of uses for aspirin. Point is, wrong fucking answer. Choice D, heme polymerase inhibitor, wrong answer. This could refer to chloroquine, mefloquine prophylaxis for malaria. Okay, so I just threw this in here as a distractor. Maybe this appeals to some students. Wrong fucking answer. Choice C, divalent cation supplementation. This could refer to calcium or iron. Wrong answer. Okay, I mean, in general, I'm trying to even think of something this could apply to. Obviously, patients who have deficiencies. Okay, pica. Patients who are eating clay, ice, starch. Okay, pregnant women in particular who get iron deficiency. Nothing big to refer to here. Point is, wrong fucking answer. Clotting factor carboxylation inhibitor. Could refer to warfarin. Okay, warfarin inhibits vitamin K epoxide reductase, and you need active vitamin K ordinarily as a cofactor for gamma glutamyl carboxylase. Okay, carboxylase clotting factors 2, 7, 9, 10. Anti-clotting factors or clotting protein CNS. Wrong fucking answer. Real quick, I will mention that warfarin for USMLE is given to patients who have prosthetic valves. That's the most important indication on USMLE for warfarin. Okay, so that's asked directly on a 2CK CMS question, where they literally give a patient who has different things going on and they just want prosthetic valve as the answer. Obviously, patients who have a DVT, they ask that. Okay, so you give heparin initially, and then you got to send the patient home on warfarin. All right, and for atrial fibrillation, if the patient has a high CHADS-2 score, CHADS-2 VASC, then you give warfarin over heparin. Wrong fucking answer. Choice A, cell wall synthesis inhibitor. Correct answer. This refers to penicillin. Okay, so penicillin is going to bind up penicillin binding proteins, such as peptidoglycan, inhibits cell wall synthesis, gram positives. So We give penicillin prophylaxis to patients who have asplenia. This is classically done in sickle cell in peds up to the age of 5. Okay, so literature varies in terms of how long you give it. USMLE doesn't give a fuck, but they do want you to know that you give penicillin prophylaxis in patients who have absent spleen. So patients who have asplenia are going to have susceptibility to particularly strep pneumo. Okay, if you have to choose one organism, choose strep pneumo. Sometimes they ask that. Encapsulated organisms. So the spleen, the white pulp, houses 50% of the immune system's reservoir of macrophages, so high phagocytic capacity. So when we clear out encapsulated organisms, strep pneumo, Neisseria meningitis, Haemophilus influenza type B, we have opsonization with C3b IgG, followed by phagocytosis in the spleen. So if we lose the spleen, we lose a significant capacity for phagocytosis, okay, and clearance of those encapsulated organisms. So strep pneumo in particular, we could give you the same fucking question here and just say, which of the following is this patient most likely at risk for? And I could have written a question such as right lower lobe dullness to percussion in the lung, strep pneumo, okay, made it real fucking nebulous and weird of a question. Okay, so strep pneumo, highest yield, Neisseria meningitis, Haemophilus influenza type B, penicillin prophylaxis for patients who have asplenia, howell-jolly bodies, ivemark syndrome, USMLE doesn't give a fuck. Be aware that Cartaginer syndrome otherwise presents with situs inversus. You know the deal. I'm to make more content. If you like my stuff, subscribe my channel. I appreciate your time. That's it.